Hello, everybody. As usual, that's Vincenzo Piccolo from Dermatology Unit of University of Campania Luigi Vanvitelli from Naples, Italy. And today I'm going to present you some case examples of a few common skin diseases of face and trunk. Making a choice about this topic was so hard for me because there are a lot of conditions that may affect skin of face and trunk, but I tried to collect the most striking examples of this condition. Let's start from the face. First of all, acne. We can't talk about facial disease without showing some cases about acne. Acne is a very common condition, usually affecting young people, characterized by some different elements appearing on the skin, such as comedones, white papules, pustules, sometimes nodules. And depending on the severity of this condition, we can approach to acne with different treatments, including tetracyclines or isotretinoin, as I gave in this patient. We have no problems about diagnosis for acne because it's easy, but the reason of concern in this patient is scarring following acne, and the proper treatment should be initiated in this patient as well. Rosacea may be distinguished from acne because of lack, usually, of comedones. So the blackheads are missing this condition, while we have erythema of the convex areas of the face, usually affecting older people than acne. And even if we can observe some cases of rosacea in children too, we have recurrent erythema associated with telangiectasia of the face, and in the last phases of disease, we can observe pustules, like in this patient, and sometimes enlargement of the nose. Patients usually experience some burning sensation after exposure to cold or warm temperature, or drinking alcohol, or eating spicy foods, and so on. In this case, the skin protection plays a key role in the treatment, along with assumption of some tetracyclines that may be very useful for this patient. A variant of rosacea may be considered the perioral dermatitis. In this case, in this patient, was granulomatous perioral dermatitis. That is a consequence of a rosacea of the periorificial area that is incorrectly treated with corticosteroids, and patient develop these very itchy papules around mouth and sometimes around the eyes, that should be treated once again with oral tetracyclines. Another very common condition affecting face, usually in children, is the atopic dermatitis with the typical eczema and vesiculation that can affect sometimes perioral or periorbital skin, with this Danny Morgan sign that you see here in this picture, some eczema of the eyelids, or in most severe cases with erosions following a severe itch of the face. The face and neck dermatitis should be considered like a variant of atopic dermatitis, and it usually affects adolescent or young children, and its appearance probably secondary to some environmental factors or psychological distress in this patient, associated to the typical background of atopic dermatitis. Each is a constant feature in this patient. Seborrheic dermatitis typically affects adolescents with this yellowish scaling, usually affecting seborrheic area of the face. In this patient, also eyelids were affected. We should look for erythema, this wet skin, and sometimes lesion also affecting scalp and auricular region. Also, trunk may be affected by seborrheic dermatitis in this patient. This condition tends to be recurrent over time and recurrent with weather changes or lifestyle changes or once again psychological distress and so on. So patients should be educated about how to treat this condition, usually topical and sometimes oral antifungal agents are given for this condition to treat it. As concerns psoriasis, face is not the most typical location of this condition, but unfortunately in children, some plaques or psoriasis may affect face that are typically found on the ear region, like in this patient, on the scalp, and sometimes on the face as well, with this erythematous scaling plaques that are seen usually associated with other lesions on the rest of the body. So it's very important to detect this condition and to treat promptly when the face is affected. It may be a reason for systemic treatment, and in the era of biological treatment, maybe the appearance of psoriasis on the face may be a good reason to start a systemic treatment in children too. As concerning tinea faciae or ringworm of the face, probably is not the most common location of ringworm. It is secondary to an infection by a dermatophyte, usually affecting the face. The diagnosis is often overlooked in these patients because of there is a delay, because we usually think to eczema, seborrheic dermatitis, rosacea on the face, acne, and so on, but we never think to a ringworm. These, you see, annular lesion with a border of progression may be very useful for the diagnosis, then confirmed by microscopic examination, then culture. In this patient, oral terbinafine or griseofulvin may be indicated to fully treat this particular form of infection. Then we have other conditions that are rarer, such as lupus, in this case, a discoid cutaneous lupus with this, you see, atrophic erythematous scaling plaque, isolated plaque of the face. In this case, I'm showing you also the dermatoscopy that for brevity I did the show in the previous picture. And what you see at the dermatoscopy is the presence of all these follicular plaques associated with follicular erythema and linear vessels that are quite typical of lupus erythematosus, then confirmed by histopathology and treated with hydroxychloroquine in this patient, and sunscreen. Please remember about that. And finally, as concerning conditions usually affecting the face, I'm going to present you this case of dermatitis artefacta. Dermatitis artefacta is a consequence of a psychiatric or psychological stress in our patient. Usually is asymmetric with sharp borders, hypopigmented lesion following previous lesion in otherwise healthy patient, in this case a child that experienced a high psychological distress due to COVID restrictions. And it's very important for us to be aware of this condition, to promptly recognize and to send this patient to the psychiatrist to correctly treat the mental condition that is at the basis of this skin condition that is usually self-provoked but not told by the patient himself. As concerning trunk, once again, eczema, just to differentiate the eczema that I showed you on the face, I'm going to show you a nummular variant of eczema where the lesions are not diffuse, but you see a patchy, like in this patient, with vesiculation and consequent crusting of the lesion, which is severe in this case and oral corticosteroids, and nowadays the monoclonal antibodies like dupilumab are very effective for this itchy condition that belong, in my view, to the category, to the large group of atopic dermatitis. Once again, to differentiate from psoriasis that I showed you on the face, I'm going to show you another case of psoriasis affecting trunk and the breast region in this adolescent girl, but it was a pustular variant of psoriasis with small lesion then merging to form these very erythematous plaques. In this case, systemic treatment with cyclosporine or biological treatment is necessary to treat the condition itself. Then we have the pityriasis rosea. Pityriasis rosea is the consequence of the reactivation of human herpes virus 6 or 7. It usually appears after a few systemic symptoms such as scar or fever or some arthralgia, with this aerial patch, the mother patch, then followed by small patches and papules, usually affecting trunk and sparing lower limbs. This is considered the prototype of a paraviral eruption and is usually long-lasting for at least 3-4 weeks until 12 weeks. The condition is self-improving with time, so no treatment is necessary, although sometimes patients can experience some pruritus or itch of the skin, and antihistamines can be given to these patients. As concerning pityriasis lichenoides, it usually affects adolescents or children. It is considered as well a post-infectious skin eruption, typically presenting with different crops of lesion, not sparing limbs, as you can see here. And you can appreciate at clinical examination a polymorphism in the evolution of the lesion. The lesion starts with a small papule, then evolving in an erythemato-crusting necrotic lesion, and then it tends to become flat again over time, with a typical scale in the center of the lesion that tends to be ruptured very easily. Pityriasis again, but versicolor in this case, the consequence of the proliferation of Malassezia furfurov or Pityrosporum on the skin of young patients. It can present with different color, that's why it's versicolor, brown, pink or whitish lesion can be seen. A very thin scaling may be appreciated on the skin of our patients, and this is very common and easy to treat condition, usually responding to topical and systemic treatment with antifungal agents. Again, this condition usually follows stress or infections or taking other medications such as antibiotics or corticosteroids for the imbalance that is created by this condition on the skin of our patient, and we usually see on summertime or springtime. Tinea corporis, again, this is a case of ringworm of the back in a child with a large lesion characterized by border of progression, some pustules, and some you see satellite lesion that start from the main one. In this case, dermatophyte is involved in the etiology of this condition, and the griseofulvin is necessary to treat it because of the low rate of self-resolution of this case. Herpes zoster, again an infection, usually affects elderly, but it can affect all the age groups with these vesicles that are grouped together, associated with erythema, and typically you see disposed in a linear metameric fashion associated with a neurological discomfort experienced by the patient himself. The diagnosis should be very fast in this patient because of the risk of postherpetic neuritis that sometimes follows this condition, even if when it's not promptly recognized and treated. And again, in infections, in this case, an infection of the trunk and the whole body in a very small toddler, characterized by intense itch and unspecific lesion with papules, vesicles, erythematoscaling patches. In this case, the role of dermatoscopy is key in the diagnosis of scabies, where you can see here you can appreciate the barrow, and here where I'm indicating with the arrow you can see the presence of this of the mite itself. So the diagnosis of scabies should be made with dermatoscopy. Insect bites are another very common condition, usually affecting trunk or limbs or face, so all the body surface may be affected, and sometimes after traveling around in the world or being in an open place, some patient can experience this condition that is characterized by this urticaria-like lesion, infiltrated and itchy, that develop all together or soon after each other, and the short course of topical steroids and antihistamines and the avoidance of exposure to further insect bites may be very helpful for the treatment. And for today, it's all, and I hope that you enjoyed my lecture. Thanks for listening, and see you next time. Bye.